Since the beginning of time, humans have been fighting the long battle against infectious microbes. Bacteria, in particular, have posed some of the largest threats to human safety for centuries. For example, the bacteria Yersinia pestis was the cause of the bubonic plague, which killed as many as 200 million people and is now known as the deadliest pandemic in the history of humanity. Even today, we are still fighting a global battle against bacteria. New modern medicine now looks to antibiotics to treat bacterial infections in humans, plants, and even our food supply. The overuse and misuse of antibiotic treatment, however, has led to a huge problem: antimicrobial resistance, or AMR for short. Bacteria have become resistant to new antibiotics by constantly evolving new genes that allow them to survive the harsh effects of antimicrobial treatment, making our modern medicine ineffective. As a result, the U.S. suffers about 2.8 million antibiotic-resistant bacterial infections and 35,000 deaths each year. Unsuccessfully treated bacterial infections due to antibiotic resistance cause about 700,000 deaths each year, and this number is expected to reach an annual 10 million by 2050. With growing concerns due to the COVID pandemic, we need to find a new medicinal method of treating these infections. This man is Tom Patterson, one victim of an almost fatal bacterial infection. In March of 2016, he contracted an infection of a multi-drug resistant and often deadly Acinetobacter baumannii bacteria. After many rounds of failed antibiotics, Tom was treated at UC San Diego Health School of Medicine, where he was given a new experimental treatment, a bacteriophage therapy. After receiving this treatment, Tom emerged from a months-long coma and began improving almost immediately. He is now alive and well and continues to teach psychiatry at UC San Diego. Tom's experience with bacteriophage therapy has opened new avenues to research alternatives to traditional antibiotics. Since his treatment, 5 other patients have been treated successfully with bacteriophages. This bacteriophage therapy saved lives and can potentially save more over time. But what is bacteriophage therapy? What does it consist of, and how can we make it more accessible to the rest of humanity?
Bacteriophage therapy, or simply phage therapy, is an innovative type of treatment scientists are implementing to circumvent the world's ever-growing resistance to antibiotics. This treatment may sound daunting, but the process is one that actually makes a ton of sense. Phages are a unique type of virus that sole responsibility is to kill bacteria, and more importantly, a specific type of bacteria with receptors that allow the phage to bind. After the binding, the phage and the host receptor, phage DNA, is inserted into and replicated using the bacteria's tools of genome replication. After the viral genome has been successfully entered into the host, the virus bursts out the cell, effectively neutralizing the bacteria. This is different from that of antibiotics that, along with possibly killing the respective bacteria, it can also kill the good kinds, like the ones found in our gut or skin flora. The reduction of this good bacterial microbiome can set up further infections. While the thought of injecting a virus into our system sounds like a backward step, the process is one that has the potential to save millions of lives, and actually has been understudied for longer than we think. In 1919, Felix de Horel explored the relationship between phage proteins and bacteria by injecting them into 4 pediatric patients and successfully treating them from bacterial dysentery. This early discovery, as well as some recent trials, such as the human phage trial that saw the first intravenous administration of phages for therapeutic use and it led to the successful treatment of A. baumannii in the pancreas, shows the potential of phage therapy and that the promise is combating our AMR and the superbug impending crisis that we are coming closer and closer to facing. While the interaction between phages, humans, and the potential immune response still has some connections left to be made, it is clear that the phage therapy has the promise and the potential to aid, if not replace, antibiotics today.
Phage therapy has been shown to have potential success in treating antibiotic-resistant bacteria in modern research. A study was published in 2020 that tested the effectiveness of phage cocktails in treating antibiotic-resistant bacteria isolated from blood samples of 54 infants with blood sepsis. This study found that the phage cocktails had 100% lytic activity against each bacterial culture, which suggests that phage therapy could be useful for treating blood sepsis in humans involving antibiotic-resistant bacteria. It does not, however, provide any evidence for how this treatment may affect human patients. A study testing the efficacy of phage therapy in UTI patients, published in 2020, found that while phage therapy was not inferior to antibiotic treatments in both outcomes and side effects experienced by patients, it was not superior to a placebo treatment. Potential side effects of phage therapy observed in this study were fever and increases in pain levels. The researchers admitted that these studies did not recommend phage therapy as an alternative treatment method to antibiotics, but they did acknowledge that the study opened the door for future studies in terms of experimental design. There are still many questions about how treatment with phages affects patients, but research thus far has shown minimal side effects. News outlets are generally more optimistic in the reporting of phage therapy, making claims such as phages being a potent weapon against superbugs and calling it a hopeful advance in medical science. Scientific literature is generally more cautious in how it approaches phage therapy, emphasizing that further in vitro and in vivo studies are necessary to better define the efficacy of phage therapy. However, the general tone of both news media reports and scientific articles on phage therapy is hopeful but cautious. Phage therapy offers an alternative method to fighting the global rise of antibiotic-resistant bacteria. It does not, however, present a miracle cure. It comes with its own downsides, just like any other treatment. It is often slow, and phages are very specific, so extensive testing must be done before treatments can begin, and the commercial availability of phages is still limited. Phage therapy is still considered a novel treatment for bacterial infections and can only be administered in cases where the life of a patient is threatened and no other options are available. The goal of this presentation is to take the novelty and the mystery out of phage therapy so that it may one day become a mainstream treatment as normal, if not more, than traditional antibiotics.